Hi everyone, it's Kate Wakelin here from Neuroendocrine Cancer Australia, and it's 1 o'clock in Melbourne time on Friday, which means it's Facebook Friday time. Thank you everyone for watching and joining me each week. It's been a really interesting learning experience for us all, I think, doing these broadcasts, but I think the feedback we're getting overwhelmingly is that they remain helpful, so we'll keep doing them as long as as long as they seem to be filling a spot for people. So yeah, look, great to be here. Just before I begin, I wanted to just acknowledge that I am living in Wurundjeri land and beaming in to you via Wurundjeri land today. Wurundjeri land is part of the Kulin Nation, and just wanted to take this chance to pay my respects to elders past, present and emerging. Something that I love to do is run along the river here, and the river is called the Burrarung. So I'm deeply appreciative of where I am. I've got a few things to talk to you about today, so I don't want to muck around. The first thing is we've been doing a lot of collaboration with the COVID-19 thing, and as I want to do each week is give you an update. So I just wanted to give you a few things that are happening. The first thing is that I can give you a sneak peek into some new information that we've been developing on the use of masks. So those of you who've been listening along over the weeks will have heard me talk about this pretty much every week, saying I think this is going to become an emerging recommendation, I guess, for people with cancer especially, to be maybe considering the use of masks. So there is going to be some information released, some official information released this afternoon, but I've got a sneak preview for you. So I wanted to let you know about the sorts of things that we're telling people more broadly, the official advice that we're giving. The first thing is that masks are generally not needed to be, or they're not recommended for people, in terms of the general public. However, we know that when you're going through cancer, things can be different, so I'll talk about that in a moment. Just going back to the general population for a moment, the people who do need to consider wearing masks very seriously are those who are unwell. So if you have people in your family and friends network who you may be coming into contact with, and if they are unwell, masks are a really important thing to consider. And I'm going to talk a bit about the attributes, or what we need to watch out for, the things to keep in mind with masks in just a moment. But if anyone does have flu-like symptoms and you do need to be sharing a space with them, then yes, please make them wear a mask, ask them to wear a mask. But also, they need to be washing their hands like there's no tomorrow. So hand hygiene is the primary way that we prevent this spread. We're all terrible at not touching our faces, and I'm as bad as the next person. So given that we all touch our faces so frequently, keeping our hands really clean is very important. And I've talked all about soap and water, 20 seconds, all of that still continues, all the advice back from March. The other thing, of course, is the distancing, the physical distancing between yourself and those around you. About 1.5 meters is what's recommended. We know that that's difficult for people, and especially when you're in an enclosed space. Maybe, if you're sharing a car with someone for an extended period of time, no amount of physical distancing is going to really change the fact that you're breathing the same air. So we'll talk a bit about that too. So the other thing just to mention about in the home, we mustn't forget cleaning our surfaces, and it doesn't need to be domestos. It doesn't need to be heavy duty chlorine bleach. Actually, there's been an increased incidence of poisonings and accidents with bleach and household cleaning products since coronavirus came into the picture. So we need to treat those products with great care. If you need to use a bleach solution, make sure you follow the instructions really carefully. Most of them need to be diluted, don't use them neat. But soap and water, soapy water is great. So just the soap breaks down the fatty outside of the virus particles, so we can just use good old detergent and water, or soap and water, and that will work really well. If you're not near a tap, hand sanitizer in your handbag or in your back pocket's a great idea. So if you have cancer, if you are immunosuppressed, and that is actually not every person with NETs, we believe. I'm actually watching this space really carefully. There's going to be a health professionals information session with the European Neuroendocrine Tumor Society coming up very soon, and I'm hoping that I'll get some more information about people who are on somatostatin analogues. But the best information I can give you at the moment is that those on their own don't cause your immune system to be suppressed. However, lots of people with NETs are older, and lots of people with NETs are on other treatments, for example, chemotherapy, radiotherapy, recent PRRT, or surgery, and those things all can make you more vulnerable. So for those people, there are some advantages to using a mask in particular situations. So those are if you need to use public transport. So for example, if you need to catch the train down to your medical appointment, first just check out if it can be a telehealth appointment. That's a good thing to consider. The second thing is if you're in a crowded place. For example, even a car, but also like a shopping centre or the supermarket where it's difficult to socially distance, or there might be people who just inadvertently come too close without being aware of their own space. So wearing a mask in those sorts of situations can be really useful. Or during hospital visits or GP visits where close encounters with other people can't really be prevented. So they're the sorts of situations where wearing a mask, if you've got cancer, can be really helpful. So just a note about what sort of masks they should be. Either a surgical mask from the pharmacy or a cloth mask is okay. And there's some evidence to say that the kind of the thicker, higher density cloth masks are more offensive. They might be offensive, but certainly more effective than the really thin, gauzy type. It's actually not so much like the holes in fabric masks are a bit big. They still will let. Theoretically, they'll let virus particles through, but the evidence is saying that they won't let droplets through, and it's the droplets that, you know, we're concerned about. So it's certainly better than not wearing a mask to wear a cloth mask. There's a couple of things about that. Make sure you cover your mouth and your nose with the mask. You see a lot of people out there with chin masks. That's not going to do you any good, or even just a mouth mask. It's got to cover your mouth and your nose. And you know, as a glasses wearer, I can say from experience that that's a real pain because it fogs up your glasses. And I don't know about you, but if you wear glasses, the thing that I do when I'm wearing a mask is, and my glasses are fogging up, is I'm constantly trying to rearrange it, and I've got to get out of that habit. We've all got to be very aware of not touching the outside of that mask, because that's actually the germiest place probably of all. So only touch the mask by the bits that are going over your ears or the bits that are tying behind the back of your head. So I'm going to put up some more information in our Facebook group this afternoon, both the official release but also some links to some videos and other information about masks that I'm hoping will be helpful. The other thing I just wanted to say was that I've just noticed myself when I've been out and about, complacency, I guess, is going to happen. You know, we've all been living with this virus in our community for some time now, and so it's really easy for people to just get distracted and forget. And so certainly for me, there's been times where I've been like out running, for example, and someone's really too close, especially when they're huffing and puffing and I'm huffing and puffing, but also in places like supermarkets and stuff. So I guess that's a place, you know, if that's you, you know, you might want to consider wearing a mask, or not if you're running by the river. I wouldn't necessarily recommend that, but I guess it may be useful to have a think about the sorts of words that you might want to use to communicate to other people that you're feeling like they're a bit close, because in the heat of the moment and when it's all happening really fast, it can be sort of hard to imagine, to work out what to say without sounding rude or without kind of putting them offside. And we don't necessarily want to be nasty to anyone. When I'm out running, I'll usually sing out "coming through," you know, and a bit of a overly friendly tone, just to make it sound like, you know, it's not, no offense, but please make some room for me. In the supermarket, it might also be, you know, just coming through, popping around the side. You know, do you mind if I pass? So just have a think for your own set of circumstances, what you could say to other people when you're out and about that might help you communicate your need for space. But I think the mask is going to be the thing for lots of you. So I think that's all I'm going to say about COVID-19 today, because I wanted to talk about a question that came up a few weeks ago when we were canvassing around for what you wanted me to chat about in Facebook Friday, and blood tests was a steady theme. So that's what I'm going to attempt to tell you about today. Now, I'm only talking for a short period of time. People go to university for years to learn everything about blood tests. So really importantly, I'm not going to tell you everything about every blood test, and the general disclaimer that anything that you see on this group space, is for your own situation. Please talk to your own doctor, because there's a gazillion different types of nets. There's certainly, you know, a gazillion types of different bodies that nets live in, and they all work differently, and so what's right for one person might not be correct for another person. So please talk to your doctor. I sound like a Panadol ad, I do apologise. So the first test that we often hear talked about that I'm going to discuss today is the chromogranin A blood test. It's a blood test. It mental blank. There's no Medicare rebate for this test, so for most people the cost is around $60. Now some people will find that the hospital will absorb the cost of that test and they don't end up paying anything out of pocket, but for many people that's a $60 charge. A lot of doctors, if they want to keep an eye on that test, they'll want to do it around 4 times a year. The other thing just to say about the cost of that test is that for people on the eShine program, that there is a rebate available for that test. So that's just important to know about, and I actually put some information up about the rebate for that test last week in the group. Let me know if you can't find it. So it's a marker. It's a protein that is released by neuroendocrine tumours, and so when it's going up or when it's going down, it can be an indication of tumour growth or tumour regression, tumour activity generally. Now the really important thing about that is that it doesn't go up for every person with NETs. So just because your chromogranin A is normal doesn't mean that you don't have activity from tumours. So it's not like a be-all and end-all test, but it can be a really useful indication. Now one test on its own is not that useful because everybody's are slightly different, and so what might be normal for you might be, you know, alarming for another person. But what we like to do is look at these things and the trend over time, and that's why they want to do it at regular intervals throughout the year, because they want to sort of really get an idea of what the behaviour of your tumour is over time. And if they're seeing those numbers raising steadily, they might be more likely to bring something like a scan further in, closer in, so that they can check out what's going on a bit more. So it's a bit like a barometer. It might kind of fluctuate and go up and down, but if there's a steady trend, we want to know about it. There are other things that can affect the chromogranin A. So that's the other thing. If you get a chromogranin A test that is elevated and you're thinking, does that mean my tumours are on the move? Well, not necessarily. So there's some medications that can affect chromogranin A reading. So the one that probably lots of you will know about if you're having these tests is the PPI, drugs that are like, they're anti-reflux drugs. So, and it's tricky because a lot of people with neuroendocrine tumours get heartburn and indigestion symptoms. So these drugs are hard to come off. There's some variation in what doctors will say about this. Some doctors will say, well, look, if you're on a stable dose and you're always on that dose, and we know the chromogranin A reflects you being on that drug, then, you know, maybe it's okay to stay on it leading up to your test. But most people will be advised to come off PPI medication at least 2 weeks before that test. But talk with your doctor if that's too difficult or really uncomfortable. Then talk with your doctor about that. There might be some leeway, but it's really important that if you're on those drugs, that your doctor knows about it, and really ideally you should be off them to have the test. So the other thing is that other things in your body can affect those tests. So for example, your kidney function and your liver function, and both of those things can fluctuate when you've got neuroendocrine tumours and when you're going through other treatments. So that's important to know. There's a few other things like inflammation, like stress can actually increase it, and also, well, you know, for 50% of the population, prostate cancer can actually also affect it. So I'm not saying if your chromogranin A's gone up that you've suddenly got prostate cancer to worry about as well, but it's just to say that neuroendocrine tumours are not the only thing that can change the levels of these drugs. So the other test that is often done that's very similar, and it's looking at a similar thing, is the 5-HIAA. And I'm not going to even attempt to pronounce what that stands for. I can't. I've tried. I've practiced lots of times. You have to believe me this morning, but it's too hard to pronounce. But it's 5-HIAA. And the really important thing about that is that it's a 24-hour urine collection. You've got to collect every drop. And it's tricky if you get diarrhea because obviously they need to just have the urine and nothing else. That measures the byproduct of serotonin in your body that's being filtered out through the kidneys. A lot of people with neuroendocrine tumours, those tumours produce too much serotonin, especially when they're on the move. So again, it's a bit of a measure of what the activity of your tumours might be. Now, there's lots of people with NETs where the 5-HIAA is, very low, continues to be low regardless of what those tumours are doing. Sometimes you can get fluctuations in that 5-HIAA and it's not actually indicating any growth or anything of concern. So again, if you get a high reading, it doesn't necessarily mean it's panic stations, but again, it's a useful indicator. Now, there are some medications. There's actually a whole big list of medications that affect the 5-HIAA. So if you're having that 24-hour urine test, the lab should give you some information. And if you go there and go and collect your bottle so that you can funnel your wee into this bottle over a very entertaining 24-hour period and try and avoid too many spills, they should give you some instructions. Now, with the medications is the topic of food and 5-HIAA tests. Really interestingly, there's a whole heap of variation from lab to lab as to what foods people will be told to avoid leading up to these tests and the amount of time that they should be avoiding those foods for. And we've known about this for a while. And we're actually, before coronavirus really hit our shores, we were in the middle of a project with one of the major testing labs working towards what we call harmonisation, which means that everybody's singing from the same hymn sheet essentially, to work out, well, is there any evidence to say that food changes at 5-HIAA level anyway? And if so, what are the actual concrete recommendations? Because one lab will say this and one lab will say that, and we're not comparing apples with apples. So we had to put that study on the back burner while everyone in lab world is scurrying around chasing coronavirus research, but we'll definitely be getting back onto that. So shout out to our consumer advisory group members who are helping to drive projects like this. Where there's no way as a really tiny organisation that we could push forward the collection of evidence around really important topics like these. But we know that these actually make a big difference to your lives. For some people, the list of foods, once you take out all of the ones that you can't have for your 5-HIAA and then all of the other dietary restrictions that lots of people with NETs need to comply with in order to stay well, it doesn't leave very much left to eat. So we want to make sure that we're telling you things that you actually need to do and not wasting everybody's time and effort. So that's 5-HIAA and chromogranin A. There's another test that I wanted to mention that's a marker for a different type of neuroendocrine tumour. And they're the ones that grow in people's adrenal glands, or sometimes you can get them growing in other parts of your body. So if they're in your adrenal glands, they're called pheochromocytomas. And yes, I did need to practice to say that word. And the version of a pheochromocytoma, if it's growing elsewhere, is called a paraganglioma. So these tumours can also produce their own hormones. And the test that we use to monitor for that is called the plasma metanephrines. And the only thing I'm going to say, because there's that's quite involved, and there's actually a fact sheet on our website about their preparation and lead up to that test. So some really important things, for example, needing to have a lie down before that test is done, because obviously we don't want to measure your adrenaline levels if you just had to really fight to get a car park and you've just run up the stairs, because your adrenaline levels will be different. So the plasma metanephrines test, just a quick note to say, have a look at the fact sheet on our website if you have a pheo or a para and are having monitoring for that. So there's 3 other tests that I wanted to talk about, and they're all blood tests, and they're ones that I get questions about quite frequently over the net nurse line and via email. So the first one is, it's a bunch of tests that are really looking at the function of your bone marrow, and that is important when we're doing things to you that might affect your bone marrow function. So the key one is chemotherapy. So chemotherapy affects cells all over the body that are making new cells actively. So that includes your bone marrow, that's like a factory that's making new blood cells all the time. And if we give you chemotherapy, we want it to come down or stop making new cancer cells. But as a side effect, it's not very smart. It can't just target cancer cells. It also affects the bone marrow. So if you've had chemotherapy, we want to make sure that that's not knocking your bone marrow around too much. So the sorts of tests that we're looking for in those to measure your bone marrow function is things like your hemoglobin, which is the iron carrying component of your blood and helps your oxygen to get to the oxygen carrying component, I beg your pardon, of your blood that helps the oxygen get to where it needs to be for your body to function. Platelets is the other another important component, and that's what helps you clot if you cut yourself, or if you bump yourself, it stops you developing a massive internal bruise. And also your immune cells, so your white blood cells and your neutrophils. So they're all part of what's produced by your bone marrow. So we want to check that. Now the other treatment that can affect your bone marrow is radiation. So a lot of the time when we think radiation, we're talking about a machine that's pointing to a part of your body. If we're targeting a really big area of bone, that can actually affect your bone marrow function. But actually the one that we're careful of, and which involves radiation, is PRRT, or peptide radionuclide receptor therapy, and that gives you a very short dose of a fairly reasonable amount of radiation. So for some people that can affect their bone marrow function, and for some people, you know, they pop up on the Facebook group saying, oh, you know, my chemotherapy's been delayed because my bone marrow's not working well enough, or my blood's not good enough. They ask what they can do to raise that function, and we don't really know of anything apart from just eating a normal healthy diet. There's not really anything you can do to increase that function. It's about letting it recover, and for most people it will recover, and you will get to the point where you can have more treatment. So again, talk with your doctor if those blood cells levels are low. It might be that for me, if I had a blood level of that particular level, it would be alarming, but for someone who's had cancer treatment, it's quite within the range of what we would expect. So don't panic. Some people get a copy of their blood test results, and they panic when they see levels that are really different to the recommended ranges, but it's very individual. And if you're having treatment, or if you've got a tumour growing or tumours present, then that can be quite normal for you, for your levels to be different to what the piece of paper says it should be for a healthy person. So I've talked about bone marrow function. I'm going to talk about kidney function. So the kidneys are the part of your body that filter out all of the toxins in your blood, and keep the blood essentially like clean. So there are specific things that they will be looking for in your blood to make sure they're not getting too high, which can indicate that your kidneys might not be filtering these things out well enough. And it's all a very delicate balance. So it's things, and it's more than just what I'm going to tell you, but some of the main components are things like sodium, potassium, phosphorus, calcium. They're definitely looking at the level of protein in your blood, and also chemicals like urea and creatinine, which are like toxins that we need your kidneys to be flushing out. So that's important because kidneys are also the organ that we use to flush out things like medicines, and if you're having PRRT, they also flush out that radioactive protein solution that we've given you in the drip. So we need your kidneys to be working really quite well for that treatment. And so they'll be monitoring that in your blood tests as well. Now there's one more blood test, or one more lot of kind of category of blood tests that I wanted to just basically cover today, and that's liver function tests. And these, I'm not going to pronounce the names of these individual tests because, again, you've got to go to uni for longer than me to be able to pronounce them. But if a lot of people do contact me saying, oh, my GGT or my LD or my AST or my ALP or my ALT, are wonky, and they're really worried about that because the numbers that they've seen on their blood tests are different to what the recommended range would be. It's actually really quite common for people who have cancer to have liver function tests that read differently to the normal range. So it's, again, not necessarily a need to panic. And I remember when I was a baby cancer nurse and I was working with people having chemotherapy, and I saw these results on this person's blood test, and thought, oh my goodness, these levels are really, really wacky. I need to get this person some help. And I asked the doctor, which I probably should have asked a more experienced nurse because they would have saved me some embarrassment. But when the doctor saw it, they said, no, we don't need to worry about that. If you look back over their results, they've always been that level. This person has a liver full of tumors. The liver's actually coping really well with this because it's not, these levels aren't changing dramatically. All it's doing is saying that this liver's, working to adapt to the presence of these tumours in there. So we don't need to panic about those readings necessarily. We do need to be watchful if the levels are changing dramatically. A bit like all of the other ones. Sometimes these levels, we're not so worried about what the individual number is, but we are worried about, we do want to watch trends and make sure that we're following things up if things are kind of on the rise or on the decline either way. So I hope that clears up some questions about blood tests. It's a really complex area, and as I said, I could talk for hours about this, but I've just wanted to cover the main ones. In terms of resources, there's heaps of good resources out there that you can look at that give you more information. So the first thing is, sorry, I stuck this book slightly out of reach, but our guide for patients, for people with neuroendocrine tumours, has got a really good, really well, quite simple description of some of the different sorts of blood tests that people can have. And that's on my book. It's page 24. So you can download that book from the website, or we can send you a hard copy. So let us know if you want the hard copy of that. Sometimes it's good to have a hard copy so you can stick your post-it notes in it and get the highlighter out. But if you've got a reasonable printer, then printing a version out from the website's a good way too. The other resource that is fantastic for lab tests is a website called Lab Tests Online, and I will put a link to this in the notes. You can type in anything into the search bar and it'll sort of filter through, and it tells you in I understand the language, so I figure if I can understand it, then most people can understand it. It gives a really quite simple explanation about what that test is for, what other things might cause that test to be up or down, some of the things that they want to be watching out for. It doesn't give you reference ranges because that varies from lab to lab, but if you are, you're thinking, oh, well, what is an ALT or a GGT, or, they sound like sports model cars, but actually they're a component of your liver function tests. So that's a really great website to have a look at. So I'll link to that in the notes. So I just want to have a quick look through my little notes to make sure I've covered all of the things I wanted to talk about with the lab test. And I'm going to have a quick look at the questions. Some of the questions I think I'll probably need to count as homework, but I'll just have a very quick scroll. Yeah, look, there's lots of comments. So thank you everyone for watching. That's really lovely. I'll come back to the questions, I think, and provide some answers individually because there's too many for me to read, and I don't want to take up any more of your Friday. It's a beautiful day here in Melbourne. I don't know what it's like where you are, but maybe it's a good opportunity to get some sunshine for those of you who can. Before I go, a couple of little plugs. The first one is that our conversation from last week with Associate Professor Ben Thompson, that a Facebook Friday live feed dropped out after I think a record of 4 seconds, so thanks everyone for being patient. The video is in our Facebook group, but that one he also gave permission for us to put in our YouTube on our YouTube channel. So if you wanted to show that to other people in your family who aren't part of this private discussion group, then the link I will put in the notes. The other video that you might have spotted that has arrived this week onto our YouTube channel is a beauty, and that is from our Adelaide support group. So our Adelaide support group met via Zoom recently and had a cardiologist called Dr. Daniel Chekic, who provided us with a whole heap of really comprehensive information about hearts and nets. So it's great information. It's on our YouTube channel. I'll put a link in the notes again. So it's actually hearts and nets was one of the things I had on my list of things to talk about in a Facebook Friday, but I don't think I can there's no way. This doctor has given a really comprehensive overview with slides and all that sort of thing. So I would just really recommend that you have a look at that video. So yeah, link in the notes. The only other thing I wanted to say to you is that thanks to everybody who logged in for our online group Zoom meeting this week. So most of you will know we've got lots of geographically based groups that are all meeting via Zoom at the moment. I know our Canberra group met this morning, and we've had lots of meetings and a few more coming up over the next couple of weeks. But our online group, our open group, met last week. So this is a new monthly group that we've been piloting, alternating between an afternoon meeting and an evening meeting, and we had an evening meeting last week. Now, can I just say it was so fantastic. Over half of the people in that group were from regional rural areas where it's hard to get to a face-to-face group even when there's not coronavirus, but also some people who find it hard to get out of the house. So that's exactly who this group is for. So and actually it was a really special conversation. We talked a lot about just the value of hanging out with people who get it, who really like that empathetic nodding of the head, even though we're all we're on a screen, so it's not like we're in the same room together, but there's still that really very real empathy that is just so encouraging to be talking with people who really get it. So I felt really privileged to be in that space last week, and so just wanted to give a plug. I can see that lots of people have already clicked that they want to join in on that next conversation, which will be on the 17th of July. It's on a Friday afternoon, so it's going to be after Facebook Friday. It's via Zoom, and it's there's an event in our private discussion group. So if you go to the events tab, it's in there and it'll be on the 17th of July at 2:30 in the afternoon Melbourne time. So I know that's earlier in the day if you're in Perth or Adelaide or Darwin or in those states. All you need to do is click. If you can click that you're interested if you're not quite sure if you'll be able to make it, but if you really want to get the information about this, click going, and then on the day of that meeting I will send via private messaging on Facebook, I will send a message to everybody with the link to the Zoom room. Now the only other thing I wanted to say very briefly about Facebook Message is that most people are fantastic and either ring me, but really great when you can email me, because then I can see and prioritise and work out how to respond to that. So if you've got questions for me, net nurse type questions, then email's superb, and lots of you do that, and that's fantastic. Facebook Messenger I use for things like Zoom links. I use for things like group, private discussion group memberships, administration. Please don't send me patient questions and answers stuff on there, because it will just get lost. I get literally hundreds of messages a week in that space, and I just worry about missing really important clinical questions in that space. So if you've got a question for me as a net nurse, as a net patient, as someone who's caring for someone with nets, send me an email. So the email is netnurse@neuroendocrine.org.au, and usually it takes a couple of days to get a reply, because I'm often working on the emails from the previous day or the phone calls from the previous day. But that's the best way to get in touch with me. So I'm not going to take any more of your time. It's been lovely to talk with you and to see you again. I hope that's a bit helpful in terms of the lab test stuff. But for future Facebook Fridays, let us know what you're interested in. What else would you like us to talk about? We've got a few things in the wings that we're working on, so a few more guest speakers, and I'm needing to go back to tech school to make this Facebook Live not crash, but that's my little bundle of challenges. Let me know if you're a tech expert and we can maybe work it out together. All right, I'm stopping now. Have a great afternoon, everybody, and I'll talk to you next week.